Hi, my name is Dr. Jana, and I'm a pediatrician and co-author of Heading Home with Your Newborn from Birth to Reality. I am very happy to partner with Durrell Juvenile Group and the Safety First brand to discuss with you topics of parenting interest. And I'm pretty sure that today's topic on fevers and a child's first fever is going to be of great interest to most parents. If we're going to talk about fevers, and first fevers in particular, I like to start out by giving parents a little bit of a frame of reference because there is sort of this underlying fear factor when it comes to a child's first fever. And it's very understandable because we do know that in general, fever represents something going on, and it usually an infection that can make a child very uncomfortable, and it can be very disconcerting. That said, fever is also the body's way of fighting infection, and in many instances it actually serves a useful purpose. So finding a happy medium between being overly scared of fever and at the same time having a healthy respect for fever is going to serve you very well. To be able to decide how seriously to take a fever, it's first important to distinguish between the newborn period and older infants and children and adults as well. In the newborn period, somewhere in that first 2 to 4 months, it's very important that parents take fever more seriously than they might otherwise, because we know that newborns' immune systems are not fully developed. And that means that they're more at risk of a potential serious infection, and that infection may spread better than it would once their immune system works properly. So in those first few months, be sure that you report any fever to your child's healthcare provider. If you're going to be talking about taking temperatures, and this is certainly true in the newborn period, but actually for the first year or two of life, rectal thermometers are definitely considered the gold standard for getting an accurate temperature reading. As soon as I say rectal temperatures, I usually make about half the parents I talk to cringe at the thought. But the fact of the matter is that it's actually very easy to take a rectal temperature. It rarely bothers a child. In fact, sometimes you can take a temperature of any child who's diaper age, who's used to laying down and having their diaper changed without them even waking up while you're doing it. The good news for parents who are a little uneasy about the process is that you also now can find thermometers that will give you accurate readings that are very easy to use. I've got an example of a rectal thermometer. This happens to be the Safety First Easy Read rectal thermometer. But you'll notice one of the things parents worry about is how far do they put the probe in to get a temperature. Here you see this one's designed so that's really sort of a foolproof way to take the temperature. It's designed for rectal use. It has a quick, easy push the button, big digital screen. It actually has a light to be read at night. By looking for some of those added features to rectal thermometers, you can make it easy to take a very accurate temperature for your newborn and for your infant. Again, I find it actually easy to do all the way through the age when children are still in diapers. Once you have that number, you're going to want to report it if you have any concerns, or if you have a newborn, report it to your doctor without changing the numbers on the screen. You take the number that you've got and you report that temperature to your doctor and just tell them how you took the temperature. Don't add a degree, don't subtract a degree. Moving forward, understand that we don't need to treat all fevers. In the newborn period, we need to take them all seriously, and later on, it's a sign of an infection, but it may be a good sign that the body's fighting infection. So talk to your doctor about what other signs or symptoms your child has to decide whether or not you actually need to treat the fever. And if you do, realize that treating a fever is to make your child more comfortable. It does nothing to make an underlying viral infection, for example, go away. So the goal is to make your child feel comfortable enough that they can continue to drink and not get dehydrated. Thanks for listening. It's been fun sharing these tips with you, and I certainly encourage you, if you haven't already, to go to the safetyfirst.com website. Feel free to sign up for their e-newsletter for additional tips, and also check out Safety First on Facebook. Again, I'm Dr. Jana, and it's been great joining you.